Hi, it's Kevin and welcome to the next video installment on the assessment and management of GTPS. So following the assessment in our last video, we are now talking about the first part of GTPS treatment, so the patient education section. This will be heavily based on the work by Grimaldi and colleagues in her papers in 2024 and 2025. The most important part of the education is to reduce the load irritation, so load management. The first thing we look at is postures that the patient might adapt that could be irritating an already sensitized hip. So this is, for example, sitting cross-legged, hanging off the hip, sort of home stretches or even physio exercises that have these kind of stretches in it, so putting pressure on the lateral hip. And then lie-in position, so if we lie on this side, so bad side up, and pressure putting on the lateral hip, so either having a pillow underneath or lying on the back to try and decrease that pressure, so that can sometimes help. Also with their activities, trying to modify the load so they can continue doing their activities, and then building up slowly, so around 10% a week. Reduce things like hill walking if that is a problem, stair climbs, so obviously going up and down stairs we need to do anyway, but if say somebody is at work and they have 5 flights of stairs to do multiple times, then maybe going in the lift. And then when they are going upstairs, walking with their feet hip width apart, and use a rail on the opposite side to the painful hip, as well as things when walking, so reducing stride length, landing more softly, and as it says on here, reduce walking on the camber, so the slight slope that can put pressure on a sensitized hip. A little bit further on, so again with the gait, prevent overstriding, make sure they don't have a narrow step width or knee window, so that's obviously the space between the knees, and on the stairs, as we mentioned, going up and down, keeping their hips hip width apart. So this brief educational video has talked about positions that we can try and use to decrease the pressure on the hip, so sitting cross-legged, hanging off the hip. Nighttime position, so instead of side lying, increasing pressure on that hip if it's adducted, putting a pillow underneath or lying on your back, avoiding certain aggravating stretches, and then modifying load. So if they're quite an active person, decreasing the load to a level they can still do that doesn't aggravate it, and then build them up by about 10% at a time. If they are doing things like hill walking and things, obviously try and minimize the hill walking, modify the stairs if we have to, and with gait we can look at affecting the overstriding and increasing the width of the knee window, and that can help as well, especially again going upstairs, legs hip width apart, holding the rail on the opposite side to the bad hip. So I hope you found this quick video useful, and until next time.